Welcome back to another episode, all. Before we move on, if I could ask you to subscribe to my channel. In this episode, I'm going to talk about fake disorders that people talk about and complain. Many people are self-diagnosing themselves with so-called disorders, and many people find this problematic. Those of you who do find self-diagnosis problematic, you don't want to be pointing your finger at those who are self-diagnosing. You need to point your finger at the psychiatry and big pharma. Basically, in the name of capitalism, psychiatrists have medicalized the human and have classified humanity itself as a disorder. General, ordinary day-to-day human experiences have been classified as symptoms of disorders to make more people worthy of a diagnosis. Without diagnosis, the prevention industry, the pharmaceutical industry, and the interventionist industry can't make themselves money. When someone goes for a clinical diagnosis, they're diagnosed as a human. That's what the diagnostic criteria is. On Facebook, I see numerous organizations selling the same products for things like stress, anxiety, and depression. Before the 21st century, stress, anxiety, and depression were seen as symptoms of a disorder, not disorders in and of themselves. If we take depression as an example, anyone can experience depression, so everyone fits the criteria of a depression disorder by today's diagnosis procedure. In the past, a psychiatrist would have seen the depression as a sign of an underlying problem. So instead of automatically skipping to treating depression with drugs and devices, they would have identified the cause of depression to see which is best, which is the best option to help someone recover from their depression and would solve what's causing the depression. On these advertisements, I write a question in their comments section which exposes them as liars. As an example, there's an organization called Neurodiversity. They claim their device cures people from ADHD. Listen, it stops brain fog, anxiety, stress, depression, problems with the nervous system, and a few other things. I pointed out to them, anyone can experience those health problems. What has your device specifically got to do with ADHD? Your device is about the vagus nerve. The vagus nerve is not part of the ADHD diagnosis criteria, is what I asked them. Once I wrote that, they deleted the claims about ADHD from their advertisement. There's one example of how doctors are describing general human experiences as part of ADHD, making more people believe they have ADHD. It's the capitalists encouraging people to have a disorder, increasing how many people identify themselves as people with a so-called disorder. Autism is another good example. Lots of so-called symptoms are just ordinary, harmless traits. Before 1994, no one would have diagnosed me as autistic. When we look at those who were not diagnosed until they were adults, so many of them lived an ordinary life. I can see some people change their beliefs and expectations about autistic people once they receive a diagnosis, and the individual diagnosed complies with the characteristics of autism. It's clear that it's capitalistic professionals who are encouraging people they have a disorder, which should explain why so-called disorders are on a constant rise. So yes, those who have a problem with self-diagnosis should point your fingers at psychiatry for medicalizing the human condition. From a medical lens, we have psychiatric disorders, neurological disorders, developmental disorders, genetic disorders, mental disorders, and more kinds of disorders. Can any of you see something all these things have in common? If not, you may be able to do so when we look at the historical context. In the 19th century, people who protested against slavery had a medical disorder called drapetomania. The LGBTQ was seen as pathological until 1974. Left-handedness was seen as a pathological disorder. Dark skin was seen as a disease, and more things down those lines. The common denominator I see among all these so-called disorders is not statistical deviation, but it's social deviation. Any human traits that deviate from a social norm are automatically labeled disorders by psychiatry. It's got nothing to do with health, but everything to do with capitalism. Nick Walker writes, I quote, "The choice to frame the minds, bodies, and lives of autistic people or any other neurological minority group in terms of pathology does not represent an inevitable and objective scientific conclusion, but is merely a cultural value judgment. Similar pathologizing frameworks have been used time and again to lend an aura of scientific legitimacy to all manner of other bigotry and to the oppression of women, indigenous peoples, people of colour, and queer people, among others. The framing of autism and other minority neurological configurations as disorders or medical conditions begins to lose its aura of scientific authority and objectivity when viewed in this historical context. For some years prior to the American Civil War, the desire of slaves to escape from slavery was diagnosed by some white Southern physicians as a medical disorder called drapetomania." Close quote. Big Pharma is using everyone's needs to make money. More people die from prescription drugs than drug abuse these days. Someone called Dr. Alan Francis says, I quote, "Putting aside all the problems with the DSM-5, the simple fact is that psychiatric diagnosis has become way too loose. Today, 25% of Americans meet the criteria for a diagnosis in any given year. 20% of us take psychotropic medication. That's 1 in 5 people. We now have more deaths in emergency rooms from prescription drugs than from street drugs. Pill popping is rampant, along with all the unnecessary side effects of drugs. The new DSM will just make this worse." Close quote. I'm sure that's because people are being treated for so-called disorders they don't even experience. A study was done by British Columbia University on ADHD drugs prescribed to over 1 million school children. Researchers found that children were 39% more likely to be diagnosed with ADHD and 48% more likely to be treated with medication for ADHD if born in December compared to January. Due to the December the 31st cut-off birth date for entry into school in British Columbia, children born in December would typically be almost a year younger than their classmates born in January. According to the lead author, Richard Morrow, the relative age of children is influencing whether they are diagnosed and treated for ADHD. Our study suggests younger, less mature children are inappropriately being labelled and treated. It's important not to expose children to potential harms from unnecessary diagnosis and use of medications. Close quote. Someone called Dr. Gabriel Maté writes in his book called The Myth of Normal, I quote, "When I got into psychiatry, Dr. Perry told me, it became clear really quickly that the diagnosis were not connected to the physiology, that they were just descriptive, and that there were hundreds of physiological roots to someone having an attention problem, for example. And yet the profession acted as if these descriptive labels were really a thing. I knew that if we were doing research, if we were using these hollow descriptors, which we call diagnosis, and then study interventions and outcomes, we would just get garbage, and that's what we've done." Close quote. The individuals were drugged because they deviated from a social norm. People are being drugged for being human, as if humanity is a disease that needs treating. The way psychiatry works today, it's labelled humans in general as disordered, because social norms are constantly and gradually changing. So who is worthy of a diagnosis constantly changes. Additionally, disability is contextual. There's been cross-cultural studies of autism, which have shown that culture shapes the way families, professionals, and communities understand and treat developmental disabilities. Of the developmental disabilities, interpretations and treatments of autism are particularly susceptible to the influence of culture because there is no agreed upon cause. Diagnosing autism relies heavily on behavior criteria, and behavioral norms vary considerably across cultures. If you don't like self-diagnosis, you need to tell psychiatrists to stop profiteering on human needs and to stop pathologizing ordinary human experiences and traits. For example, autistic people and their discomfort with change. Just about anyone can be uncomfortable about changes. If we think about stimming, non-autistic people stim. If you think about people that like small talk, there's some non-autistic people that like small talk. If you think about routines, there's lots of non-autistic people that like routines. So going on just basing it all upon behaviors, social deviation, that's bound to result in inaccurate diagnosis, mismedicating individuals, more profiteering. As if you just allow me to turn to a book to my right, to quote someone from Autism, about a book called The Autism Industrial Complex by Professor Alicia Broderick. Someone called Elizabeth B. Torres, PhD, a professional computational neuroscientist, writes, I quote, autism is at an inflection point today. We are poised for a paradigm shift in autism research, education, and therapies. This book initiates that shift and does so superbly. In the autism industrial complex, how branding, marketing, and capital investment turned autism into big business, we'll learn about the history and evolution of this multi-billion-dollar per year operation. Thanks to this history, we'll remember Lovaas, ABA, and behaviorism in general, not as a science, but as a branding, rhetoric, and marketing plot that transiently misguided many well-intended parents and professionals, and that in so doing profited with greed by preying on our human hopes, our trust in science, and our fears. End of quote. So yeah, big pharma, the medical system, altogether through psychiatry are misdiagnosing people so they can treat more people to make more money. If you made it this far, thank you for listening and please subscribe. Thank you.